Okay, so good evening, everyone. Welcome to another wellness workshop. So I'm Kiyomi with Center of Life, and we are super excited to be able to have Planned Parenthood on with us tonight. So we have Planned Parenthood of Western PA's new CEO, Sydney Etheredge, on with us. That's going to be able to have an open dialogue about the services that they offer, as well as Planned Parenthood history and just sort of the services that they're doing here in Hazelwood. We also have Christine Gordon with Planned Parenthood on with us. And then we also have Jessica Hoba that's going to be working with Planned Parenthood, which we're really excited about. So we're going to go ahead and pass it over on to Sydney, who's going to talk about their services. And then if you have any questions, please feel free to go ahead and put them into the chat. Or if you feel comfortable enough, you're welcome to unmute yourself as well. But we will have this recorded. We will share this on our YouTube page. And then I'll also make sure to share out the recording after the presentation.
Great, thank you so much. I am so excited to be here tonight to connect and just to talk a little bit about Planned Parenthood of Western Pennsylvania, the work that we do, and just answer some questions. My name is Sydney Etheredge, and I'm the new president and CEO of Planned Parenthood of Western Pennsylvania. And I just took this job in January and moved back to the city of Pittsburgh for this role. And I'm very excited to be getting out more and doing more things like this within the community. So thank you for having me here tonight. So tonight's presentation, we'll talk a little bit just about the history of Planned Parenthood more broadly, and then speak more specifically about Planned Parenthood of Western Pennsylvania and the services we provide, the communities we serve, and then spend a little bit of time just talking about some specific services and just some of the work we do within our communities. So want to start out with kind of a high level overview about Planned Parenthood's history. I think it's always important for us to look back as we begin looking forward. And so wanted to just kind of mention Planned Parenthood was founded in 1916. And at that time, birth control was not legal. So providers could not share any information about controlling fertility with their patients. And this was really kind of the impetus that started Planned Parenthood. They were called the Birth Control League, which later became Planned Parenthood, really focused on letter writing and lobbying to change these anti-obscenity laws. And so talking about birth control would fall under one of these anti-obscenity laws. And so there was just a group of people on the ground who were like, this is not right. And so really, what could they do to change that? And so one of those people who was really engaged in this movement was Margaret Sanger. Margaret Sanger founded Planned Parenthood and coined the term birth control. She was working at a nurse in New York City where the original Planned Parenthood started, and just really witnessed a lot of suffering and pain and death being to women because women were forced to bear children because abortion was not accessible, and topics around birth control and fertility were not just discussions that were happening with doctors and their patients. And so her role as being a nurse really turned her into a writer and someone who really focused on women's rights and having them control their own fertility. And so while that work was very groundbreaking, it's really important to flag that Margaret Sanger, while she lobbied for legalized birth control, she also held racist and ableist beliefs. She was someone at that time in the early 1920s who really supported the eugenics movement. And she did speak to the KKK to advocate for birth control. She wanted it to be legal to sterilize disabled people. And there are just a number of other instances in her writing and some of the things that she did that really kind of bolster these beliefs that she had. And that is something that I like to mention, and it is important for us to mention because, you know, providing good care for our patients in the present really requires us to look back at this legacy of white supremacy that has been kind of baked into our organization, and really think about and challenge ourselves about the ways that it manifests in us both individually and institutionally. And so while, you know, the Planned Parenthood was founded on someone who had these beliefs. The current president and the years after Margaret Sanger kind of was no longer associated with the organization, and as it continued to grow, we've really been able to reckon and really think about their past and how it needs to impact and kind of change our future. And this is just a quote from Alexis McGill Johnson, our current president of Planned Parenthood. And she just says, "We can't fight for rights or freedom for groups we don't see as human. And so we have to finish the work that Margaret Sanger didn't do, the harm she started but could not heal without us, this federation in this moment. This is our work. When we understand how race operates, we realize we need a more nuanced, complicated way to understand our patients' lived experiences and frame our decision-making around them. And this is why intersectionality matters." And so this is something that I really like to mention and uplift. During my time when I was working for the National Office of Planned Parenthood, I worked both under Alexis and the previous presidents as we were really thinking about how do we reckon with our past but build a better future, and realize the work that we have to do regarding race, regarding gender identity, regarding socioeconomic status, regarding all of these things that make us humans and make us our complex beings. How do we take all of those kind of our lived experience, the way that we are as humans, the way that we engage with one another as a society, and how do we build that into the family planning kind of experience and the work that we do at Planned Parenthood. And I like to think of myself as a student of that work and someone who, as a Black woman in this space, is continuing to figure out what more we need to be doing as an individual, as an affiliate, as health centers, but also as a movement to make sure that we are continuing to grow and learn and meeting the movement and bringing the movement where it needs to be and meeting the people in it where they're at. And so that's something that I'm really excited to continue to do here at Planned Parenthood of Western Pennsylvania, and work with our team to think about how we are doing the best for our patients and for the movement at this very pivotal time where we're seeing so many different groups' rights being kind of stripped away. And so fast forward from 1916 to where we are now in 2022 and where we are as Planned Parenthood of Western Pennsylvania. So we are a mission-driven organization, and that mission is really to empower individuals to make these independent, informed decisions about their sexual and reproductive lives. That means by providing healthcare services that support that and promoting public policies that allow patients and people in our region to really have access to this information, make informed decisions, and get the care that they need. We are really a three-pronged organization. We have our health services, we do education work, and we're very engaged in the advocacy space. And what we believe in is really the right to privacy. We believe in affordability, high quality care, client education, respect, reproductive self-determination, confidentiality, and diversity. These are just kind of cornerstones of the work that we do, and we always try to implement in our day-to-day work with our patients, with our partners, with our staff. And this is something that I really feel strongly about stepping into this role, how we can bolster that for those different communities and continue to build. So when you think of Planned Parenthood of Western Pennsylvania, we have 7 health centers that serve 26 counties in Western Pennsylvania. So you can kind of see on this slide, I have a list of a number of the counties that we serve and where we see patients from here, but also across the state and the region. I will flag that we do have sister affiliates to our east. So Pennsylvania is not just home to Planned Parenthood of Western Pennsylvania, but also Planned Parenthood Keystone and Planned Parenthood of Southeastern Pennsylvania. So say you were in Pittsburgh and you drove to Harrisburg and you needed a birth control refill, or you needed a pap smear. You could go into Planned Parenthood of Keystone and they could serve you as a patient. And say if you drove all the way to Philadelphia and you needed a similar service, you can go to Planned Parenthood of Southeastern Pennsylvania. While we are separate entities, we work very closely together, especially on our advocacy work for the state of Pennsylvania, but also as just partners in this fight in the Keystone State. And so while we serve those 26, 27 counties in Western Pennsylvania, our health centers are really located in the Southwest region of the state. So we have 7 locations we have one in Bridgeville, Greensburg, Somerset, Johnstown, Moon. And then in Pittsburgh, so in Allegheny County, we have our Pittsburgh Family Planning Services, which are downtown. We have our abortion services, which are also in our downtown building here in Pittsburgh. We have our administrative offices, which are located downtown here in Pittsburgh. And then we have our Hazelwood Center, where we have our education offices and drop-in center. And Christine and the team will talk a little bit about that more in a bit. But we really try to serve as many patients as we can in the Southwest region across those counties on the western side of Pennsylvania. And even some of our partners and patients come from places like Ohio and West Virginia, given the location of where a lot of our health centers are within the state. And so a little bit more about what we do specifically here at Planned Parenthood of Western Pennsylvania. We do provide kind of a full range of reproductive and sexual health services, including contraceptive, STD treatment and testing, and abortion services. We are open on weekends and we do walk-in appointments as well. And we do accept most insurance plans. And we also provide a sliding fee scale for uninsured patients, and have a number of different programs for patients. If they come in and need services but can't afford them, we really try to make sure that we are meeting them where they're at and providing financial resources to cover those services to ensure that people who walk through the door can get the care that they need, regardless of their income or socioeconomic status. We do a lot of advocacy work as well. Sometimes I think people tend to think of us as just like the people in pink shirts that are at rallies or at state buildings. But we realize how important our advocacy work is into the offering and the accessibility of health services. So we think this is a really key part of our mission. So what we do is we mobilize supporters, we try to take action to influence lawmakers, and we also take time to educate our patients and the communities we serve about legislation that we think could either be harmful or helpful to their reproductive health, to their sexual and reproductive health kind of rights, to their information that they're getting. And so really trying to be as dynamic as we can in the policy space, knowing that kind of our policy systems and the political system in place can be a little wonky and confusing. And so really making sure that we're providing quality education around laws and legislation that could impact our patients and people in this region that we think is really important. We also provide a lot of education services as well. We do community education. We facilitate safe spaces for our youth, particularly our LGBTQIA+ and BIPOC youth. And we really try to amplify a lot of the work that we do by presenting at national and state level conferences to really talk about the high quality sex education and services we provide to our patients and to anyone who kind of walks in our door. Christine, I know you are on the line and the team is here. Do you want to talk a little bit more about our education work and particularly what we're doing in Hazelwood?
Yeah, thank you. So in Hazelwood, we opened a drop-in center in 2019. And unfortunately with COVID, we had to close it for a period of time, but we are happy to announce that we have just recently, at the beginning of this month, reopened it. And we have 2 new staff who are on the line here, but I don't think on camera right now because they are still doing drop-in hours. But we are reopened and we are open for youth drop-in Mondays, Wednesdays, and Thursdays from 2 to 6 p.m. And we're located in the old Hazelwood Initiative building, which is right on the corner of 2nd and Johnston, right next to the gazebo. And we work very hard to create a safe and welcoming space for young people to hang out, learn about consent, relationships, boundaries, communication, healthy, oh, I said relationships already, didn't I? Their bodies, safer sex, all of the things that I would say all of the things that people think of as sex education or comprehensive sex education, and also a lot of things that people don't realize are a part of our comprehensive sexuality education. And we do this in a developmentally appropriate, inclusive way. We also offer resources to the community in terms of safer sex supplies, so people can come in and get free condoms, things like that. Can also offer free emergency contraception, the kind that you can get over the counter, and free home pregnancy tests, along with menstrual supplies, informational brochures, referrals to other community resources, and just a fun place for people to come, whatever the age, and specifically for middle and high school age youth. And we've been working with a lot of community partners for a long time, and are very excited to be starting to do more of the community events now that the weather's warming up. We can do more outdoor things and attending those, and some of our own events, like Ciara and Danny, who are the drop-in center staff, are planning a Juneteenth special event as well, and they have a regular plan for lessons, which happen about once a week as well. So,
and we're going to have
lots.
some art and craft type workshops as well. We're working on implementing more diverse and inclusive programming that targets, all the age groups in the community as well as the youth.
Wonderful. Thank you so much, Danny. Yes, I couldn't see your picture come up because I can only see 3 people at a time on top of the slides, but I'm so glad you're able to hop in there. Yeah, and exactly what Danny said, we'll be working on parent and adult workshops that we'll present for the community, and just really looking to support and be available and be a resource for community members in Hazelwood.
Well, thank you, Christine and Danny, for jumping in and talking about the work that we're doing. Prior to coming to Planned Parenthood Western Pennsylvania, I spent 10 years at the Planned Parenthood National Office in DC. And through my time talking to staff and just people on the ground and talking about my work, so many people have a touch point with Planned Parenthood through their education services and through kind of engagement like what Danny and Christine were just talking about. And so it is really exciting for us to be bolstering and growing these services, and especially building those relationships and doing this work in Hazelwood, because providing just accurate and non-biased and non-judgmental information to our youth is just so important. And during this time where it feels like there's kind of an erosion of fact-based information, making sure that we're getting all of this education out there to anyone who needs it is a key priority. And so really excited to continue to bring that work out and about and just build on it and do more. So really proud of that and looking forward to what else we can do. And so I talked a little bit about this just at a high level, but Planned Parenthood offers a wide range of sexual and reproductive health care services. Some I think people are very aware of, like our birth control services and our gynecological exams. And some I think people might not be aware of. So like Christine said, we offer things like emergency contraceptive, we do testing, we also do a ton of patient education, pregnancy testing, STD testing and treatment. But some things that we also do that some people might not know is that we do a lot in the HIV testing and the PrEP space. So having that available for people who may need it. We also do hormone therapy for transgender and non-binary people. That is a newer service we just launched within the past 2 years. And it is something that the team and I am incredibly proud of because there is such a need in the community and in the region, both in Western Pennsylvania and some of our surrounding states. So being able to really offer that care means a lot to not just our patients, but our staff being able to be kind of a place for that service. We also do a lot of referrals for adoptions, prenatal care, shelters, and other supportive programming. As I mentioned earlier when we were talking a bit about intersectionality, we are we are all complex people and complex beings. And, our health is not just dictated by these four walls of a clinic or a doctor's office. It is dictated by our housing, by our transportation, by the food that we eat. So really thinking about how we can, if not bring some of those services in, how can we bolster those with our community partners? And so one thing that we do in our downtown clinic is we also work with the food pantry, and we have food available. If any patient or staff or anyone needs something, they can come in and grab a bag. We also are building out our relationships with local shelters and other kind of housing in groups and referral organizations, realizing that Pittsburgh is in quite a shift as when we think about housing and where people are living. And just really thinking about what else do our patients in the community need, and how can we help be a connector or actually fill that space. Of course, we provide abortion services as well, and we also do telemedicine for some of our GYN and birth control visits. I think with COVID, telemedicine was like really big push. And it was something that we were able to get off the ground for our birth control services and some of our GYN checkups and follow-ups and things like that. And so it's just a really exciting option to have, particularly as we know that a lot of people might not be able to make it into Allegheny County or to Southwestern PA for some of our centers. So how can we connect them with care, whether that's through video or a new way of kind of reaching out through technology. And so really figuring out how we can engage in that space is a key priority, realizing so many of us use our phones for so much now. So it's exciting kind of space to be in. And then here's just kind of a breakdown of our services and what we do. Majority of our services here are contraception. We do a lot of that type of care, a lot of STD treatments, a lot of testing, whether that's HIV or pregnancy testing, cervical cancer screening and treatment. So a lot of kind of your standard core kind of GYN services. And then you will also see that about 3% of our services at Planned Parenthood are abortion services. And so I did want to take some time, particularly given all that's going on politically, and just talk a bit about just facts on abortion in Pennsylvania. I think this is a really important kind of topic for us to be talking about and welcome questions, but also wanted to just create a space to let people know just kind of at a high level what care looks like at Planned Parenthood of Western Pennsylvania when it comes to our abortion services. We will not be getting into like any kind of about the actual procedure or things like that. So no need to worry about that, but just kind of keeping it high level for the sake of our conversation. So in 2011, there were about 36,000 abortions performed in Pennsylvania. And in 2017, we saw about 30,000. So we know that abortion rates are going down. That is because a lot of good work around the education space, teaching people about their options if they're sexually active. And so, that is something that continues to be an important part of this cycle. And majority of the abortions in Pennsylvania are performed within the first trimester. And in 2011, the state of Pennsylvania adopted legislation requiring all freestanding clinics, like our Planned Parenthood, to meet requirements of an ambulatory surgical facility. And so I like to mention this because I think sometimes people think that our clinics or abortion clinics are not really regulated or there's no one looking after them. And that is just not the case, particularly here in Pennsylvania, because we do have the Abortion Control Act. And what that includes is a 24-hour waiting period. So we typically have our patients, they will come in, or it can be done by video or phone, and we'll talk through them about what their decision is. We'll walk through some things that the state has us say, and then we'll also do some preliminary counseling in that first kind of visit. And then patients have to wait at least 24 hours before they can actually come in for the procedure. And so I think that is really important for people to understand that, this waiting period and the kind of conversations that we have, it really gives people that space and time between the decision and the actual procedure. And so it isn't like someone can just walk in and get an abortion immediately, or and I think that is something that people like to tend to say or tend to think that's the case, which it is just not at all. We have parental consent for patients younger than 18. We have annual reporting that we have to provide to the Department of Health regarding various health statistics. And so we report that to the state, and that is all available online and can be found and made public. And in Pennsylvania, post 24-week abortions are illegal unless it is necessary to prevent the death of the patient. And so these are all just, again, very important facts that I want to make sure people have and understand around the services that we provide. And while our abortion care is a small part of the services we do here, it is one that is very much regulated, it is very safe, and it is one that we do in partnership with the Department of Health and the state to make sure that all of that information is shared and that people are just aware of what's happening within the walls of our clinic. But ultimately, us at Planned Parenthood Western Pennsylvania, and Planned Parenthoods across the country, we really understand that the decision to have an abortion is incredibly personal, and that the only person who can decide what's best for them is themselves. And we're here at Planned Parenthood Western Pennsylvania to answer any questions people may have about the procedure, about the process, about their options, just to make sure that they get the care that they need. So it's really about meeting our patients where they're at and helping give them just non-biased, non-judgmental, compassionate kind of conversation and tools to make the best decision for themselves. We really have just amazing staff here, both on our education side, but in our clinics, who are doing our counseling with our patients and spending time with them as they're making these decisions. We're really here to just offer compassionate care in a non-judgmental way. And no matter what people decide they want to do with their pregnancy, we want to be a support for them and make sure that they have all of the resources available for them to make that decision so they can continue on with the goals and what they choose to want to do with their life. So I'm very proud of this work that we're doing here at Planned Parenthood Western Pennsylvania for the people of this region, but also across the country at a time when we know there are so many attacks on sexual and reproductive health care. But I'm eager to really, engage in conversation with all of you and with the community as I continue to do work in this role to really dispel some myths or to answer questions about this service and all the work that we do, because I think it is important for people to have all that information, and I want to be an available source for people now or later to have that discussion. So I'm going to stop sharing my screen because I've been just looking at my slides talking into this little camera, and it would be great to just see if people have any questions, or I see there's some things in the chat. So I want to, this is the Hazelwood hours. But just see if anyone has any questions or any conversation that we want to have since we're all together.
It's not so much a question, but I really love the process that we go through of options counseling. And I feel like a lot of people either don't understand it or they've heard misinformation about it. And, this is a piece that we take very seriously at Planned Parenthood. And there are some other groups that don't always, like they will provide misinformation. And so I don't know if anyone has questions about that, like what the counseling looks like or anything like that. But I just really want to emphasize that, we tell people what all of their options are and make sure that we can help them get the support that they need, whatever they choose. And we're very careful to make sure that people are not being coerced into having an abortion, because reproductive autonomy is like both sides, right? Like nobody should be forced to have an abortion and nobody should be forced to not have an abortion. So
I have a question. You brought up a good point. So you say they get counseling, people, so we can fully understand what kind of counseling do they get. And then also, you got this Roe versus Wade thing going on. Is that going to affect family Planned Parenthood if they, if it gets overturned?
Yeah, these are both great questions. So I can answer the first one and talk a little bit about our counseling process and then kind of what's going on politically with Roe right now. So yes, as Christine mentioned, we have a number of our options educators on staff in our clinic every day who are working with patients and really talking through them, not only just about what their options are, but also what these different options would look like and what things would look like. If they needed a referral for adoption services or prenatal care, they want to continue their pregnancy, what that could look like. If they wanted to go forward with an abortion and they use the medication abortion, like what that whole process would look like. If they're doing surgical, really just spending the time to let people know, like, this is what you have to choose from, or this is what you can consider, and we're really here to support you through that and answer whatever questions you have. We have done a lot of training and resources regarding things like coercion. If there's any kind of uncertainty that a patient feels at the time or feels like they're being pressured by a family member, a partner, anyone about their decision, our staff really know and understand how to kind of handle those situations and the appropriate steps to take. If they decide, it is not appropriate to provide this service today, it does feel like you're undecided or you don't feel okay with this decision, then we will work. If they want to reschedule or if they want to take time, we will make sure that that's available to them as well. So, because it can be like, maybe I don't feel good about this today, but can I call back and reschedule my appointment, or have to spend some more time with it? Like, really just trying to meet the patient with where they're at and removing any of those obstacles kind of in the way. If a patient wanted to go the route of continuing a pregnancy, how could we get them or find them a provider that they can work with? Or if they want to come back in a week, like what we would have to do to see them again.
That's good to know.
Yeah. One of the first things I did when I came on board was just shadow our staff in all the different centers and spend probably like 7 hours with our AB services, our abortion services team, and just got to kind of follow through with them and with patients and just really the care that they provide and the amount of just really listening and really trying to ask, questions to make sure that patients feel like they're in the right place they need to be to make these decisions is so important. And then also after, like, what if they need medically after, if they do go through with the procedure, if they have questions, or if something doesn't feel right, where they can call our hotline to make sure that their care is being kind of looked after, and make sure that things are all okay. But even emotionally, if there's we want to plug them with a therapist, or if they feel like they're not safe at home and they need different resources, we really provide like as much as we can to help our patients, not just with this, but with the many components of their life that they may be dealing with. And so it is something that I am really proud of, and getting to see our staff at work is just it's just like an honor to get to be a part of.
And Cindy, before you answer that second question, is there an age range? Because young girls come 13, because I know my daughter, she's 40 something, but she got pregnant at a young age, and the doctor would not release the information to me. Like, she had to tell me, because she was at an age where I'm still paying for the insurance, but she was not, they were not able to tell me the information. Mm-hmm. So is there a certain age where you would perform or not perform? You know what I mean?
So in the state of Pennsylvania, anyone under the age of 18 has to have a parental consent for the service. So anyone under the 18 would have to involve their parent, or they could go through a legal process called judicial bypass. So that would be in the case of if the teen does not feel that they're safe at home, or there's kind of concerns with their familial relationship or with their parent, and the parent won't go through with this, or they won't consent to this, then the teen or the person would have to go through a legal route, and it would be then up to the state.
Thank you.
Yeah, That's a great question. I think there is a lot of misinformation about that, but there are a lot of kind of policies and things in place to really, to make sure that if there is someone under a certain age, who has to be involved in that, and making sure that we follow that is a big part of what the state looks at.
Yeah. Can I add a little something? Do you
Yeah.
mind? So one thing that young people under 18 are entitled to is other sexual and reproductive health care that is confidential. And so providers cannot provide, because of HIPAA laws, cannot provide that information to parents without the explicit consent of the patient, right? And so this is something that we also navigate very carefully, both in education and in our clinic spaces. And, we're mandatory reporters. So if there's any kind of inkling that there is abuse or, something that requires reporting, then we would do that. But if someone is just, coming in because they're sexually active and don't want their parents to find out, then we have to respect that. And that's from Pennsylvania law.
Yeah, that's a great flag, Christine, the separation between our kind of family planning and sexual and reproductive healthcare services versus abortion services.
Thanks, Christine.
And then the second part of the question about kind of the future of access. A few weeks ago, there was a leak from the Supreme Court that gave us an indication that the court may plan on overturning Roe versus Wade. This is still a draft and they have not handed down their final decision yet, but we expect that to be in the summer. If this decision goes as it was written in the leaked draft, then it would overturn Roe at a federal level. And so what that means is that then it would kind of go back to the states, for states to decide if abortion is going to be a service that can be provided within that state. So we know that if the draft is what is actually going to happen, that probably 26 states across the country will ban abortion at the state level or restrict it to a very sort of like 6 weeks, 15 weeks of pregnancy. So a very kind of short window, I think, for those of us who have had periods before, realize like 6 weeks to realize that you missed one is not like, that's a very short window of time to then schedule the appointment to get an abortion if it was a pregnancy that was not wanted or something you did not want to continue to carry. And so we would see about 26 states. So that means over half the country would have a restriction on abortion care. Luckily in Pennsylvania, at this moment in time, if the decision were to go as is, abortion would still be a service that is legal and that patients could come in and receive. But that would be then dependent on kind of the political future and makeup of the state. And so I think this ties into a lot of just the work that a lot of community groups are doing just around educating on what's at stake with our upcoming and future elections and all of these different things. And so now, as is with Governor Wolf, things are protected, but that could change if the court does overturn Roe and it goes back to the states. So that's kind of at a high level. For us at Planned Parenthood of Western Pennsylvania, we are surrounded to our west by states that would ban abortion pretty quickly if the federal courts did. And so we are expecting that these patients will have to travel, which is pretty devastating considering how safe the actual service is, that patients will have to travel like hundreds of miles to get this care and go to a different state or just be forced to have a child that they did not want to carry. And so it is a really kind of sobering time for reproductive rights and for reproductive access. And also one of those times where it makes you think like, okay, if this protection was able to get overturned, like what else is next and what else is kind of on the line? And that's a very slippery slope, I think, that we don't want to go down, but could be inevitable.
Yeah, I'm really glad that that question was asked, because one of the things that I'm thinking about too is that, a lot of the marches that have been organized, some of the things that have been discussed are how people are traveling as far as Texas already to come to Pittsburgh to be able to receive some of those life-saving services. And so just thinking about too that, if and when this gets overturned, how this is going to disproportionately affect marginalized communities and low-income communities. And just thinking about, the communities that we have here in Pennsylvania, or just where our loved one lives, how much that's going to affect them. So I know that that weighs pretty heavily on my mind and heart when thinking about this being overturned.
Yeah, this is something, a lot of the opposition, people against abortion will say this is protecting, Black and Brown communities because abortion disproportionately harms them. But we know from before abortion was legal and what's going on, what happened in Texas since they've restricted their abortion care, that just because you ban abortion does not mean it won't still happen. And when it's banned, it makes it more dangerous. I think, a lot of us know or have heard stories about women prior to Roe having illegal abortions or back alley abortions, and having really serious health issues following those, if not dying due to that. And so banning abortion is not protecting people. It is not protecting women or people with uteruses. It's actually putting them at a higher risk, and particularly disproportionately impacting Black and Brown communities and other marginalized groups who already have such high barriers to accessing healthcare and services. And so it really is more of just a tool of kind of oppression to women, to people with uteruses, to these marginalized groups, to people with low incomes. And it is, it's something that is very concerning and weighs on a lot of us, realizing that we can take something that is very safe and very regulated and done in safe environments, and with a stroke of a pen, turn it into something that can be incredibly dangerous.
So I guess, Sydney, just in terms of, or anyone with the Planned Parenthood staff, thinking about what can people at home do in order to be able to just sort of spread some of this education or awareness, or especially come summer, if that decision is made, what are some things that people can kind of feel like they have control over to make a difference?
Yeah, I mean, there's a lot. So Planned Parenthood of Western Pennsylvania is one of 2 freestanding abortion clinics in Western Pennsylvania, and one of 2 freestanding abortion clinics west of Harrisburg, essentially. And so, we are really trying to focus on how we can continue to support our patients and just the community and region during this really stressful time. But for anyone who wants to engage, our website, our social channels, our education services at the drop-in center, if people want just information, feel free to go to any of those platforms and avenues to get it, because that is just such an important thing. And as I was saying earlier, this erosion of fact-based information in our kind of society and culture is a real problem. And so we always want to be seen as a trusted resource. So people can continue, I want to encourage people to come to us if they have questions, and doing all that. I think, continuing to engage, we're always looking for, if people want to volunteer in any way, we are always looking for volunteers in different capacities. So if people really want to do any of that work, whether that's being a clinic escort or helping us with some admin work or kind of behind the scenes, we're always looking for people who are eager to support and volunteer. I will say the state of Pennsylvania does have a constitutional amendment, an anti-abortion constitutional amendment that could be coming down the pike and on the ballot as early as May of next year, so this time next year. And so we can share some information, but there's a lot of like letter writing or reaching out to your rep and to this and like into the state house and telling people to vote no on that, to not support it. And there'll be a lot of mobilization around that, because particularly if Roe were to fall on the federal level, it goes back to state and the state level, and a constitutional amendment, no governor can veto it. So if this were able to pass and change the Pennsylvania Constitution, it would then essentially make abortion and certain other kind of fertility treatments and treatments like that potentially illegal in the state of Pennsylvania. So really want to continue to keep people engaged. And as that continues to evolve, we'll have like more information and resources about that. I don't know if Christine or anyone from the drop-in center team, if there's anything else y'all want to plug.
There's a workshop tomorrow being put on by the Black Girls Equity Alliance that is geared towards college age young people, young adults, but really open to anyone, where we're going to be talking about the link between having eroding abortion access and what will happen if they do overturn Roe, and the link with high quality, inclusive, medically accurate, comprehensive sexuality education. So that is a really important link that right now, when we don't have a lot of high quality sex education available to young people that is accurate, that means that we're gonna have even more repercussions if abortion becomes impossible or harder to access. And so I think that that's really important. And Kiyomi, I can send you the flyer for that if you want to send it out. And I also think that there are some things like, I don't know if this is quite pertinent yet, but it may become like the abortion access funds that we have at PPWP. We have the Vivian Campbell Fund for abortion access, and that is where people can donate to pay, because no abortion procedures can be federally funded, right? So this helps people who are low income be able to access abortion, since that can't be covered by like Title X, right, funding. And there's a Western PA Fund for Choice also, and I think those are important. I can send you all this after the meeting. And abortionfinder.org for people who are, not sure where they're going to be able to go if Roe is indeed overturned or eroded to a point where people need to travel more.
Yeah, Christine, I think that's a great point about this sex ed piece. Like, we're seeing a lot of these conversations about like what is being taught in schools, and particularly like focusing on sex ed and all of that. And I just find that like it is the fact that we are trying to pull or take apart or remove sex ed from comprehensive like health education at the same time when we're trying to remove the right to abortion care and have things like potentially forced births is just like, this is not a tool of trying to help people. Like, this is just clear, because we are on one hand taking away the information that people need to make these decisions, and then on the other, if they make these decisions, like any options that they have, and it is just, it really does feel like we're at this time where these are all just like tools of oppression working in one. And that is, again, if it's this, like what is it going to be next?
Yeah, and I've heard of some states, I think it was, I want to say Louisiana, but one of the southern states already trying to put a law in the books to ban IUDs and other forms of birth control too. So, all of these things, it definitely does feel like we are potentially moving into a place where any pregnancy is going to be a forced birth. And that, I think, is really scary, especially with the maternal mortality rates and the disparities in that,
Yeah, that we see in Black women, the maternal mortality rate in this country, and what little we've been able to do, I think, both on the federal and state level to really see impact there. It is all of these things are connected. I think it's a part of that kind of intersectionality and the many components of us as people and birthing people. And as we start to see all of these things kind of be taken away at once, it leaves it in a really scary situation. And so we will continue to be here and be vigilant on this work and getting information out. And it is like through conversations like this where we can just continue to talk about this more, I think in a productive way, because I think that that's really what we need, given there's just so much happening in this space at this time.
Yeah, thank you all so much for the wonderful and truly life-saving work that all of you are doing. Just like you said, like when you said in the beginning of the presentation, abortion rates were going down, but also that's because of like the education that we're able to provide. So when you remove both, that's a very scary thing. If you remove either one, it's a very scary thing, but when you remove both, it's a very scary thing. And just thinking about like healthcare shouldn't have to be political. We should just all have a right to healthcare. But I wasn't sure if anyone else had any other questions. I do have one last question for the Hazelwood team, if no one else has any other questions that's on the line here. Okay, just to make y'all sweat a little bit, like I'm putting y'all on the spot here, but so just to switch gears a little bit, for people here that might be watching this that are in Hazelwood, I would love to hear just about what are your favorite things about being able to work in Hazelwood and being able to offer some of these services to our teens. I know some of you might be a little bit newer, but I know like Christine, I know you've been working in Hazelwood for quite a while now. So just being able to hear like what are some of the joys that this work brings you here in Hazelwood?
Y'all want me to go first?
I can just plug something as like being new. I would love to just say this because I keep like Hazelwood was one of the first places coming in January. I knew how to drive without my GPS because I was going down there so much to go to the drop-in center, to go to some events, to go and just check out like the neighborhood and the community. We got our library cards from there. But the thing that I love being new is like just how welcoming everyone, and like it just feels like such a lived like community, and like people like live there, they're proud to be from there, they'll like talk to you about the good and the bad, and it's just been such a welcoming space coming back to the city and just getting to meet with so many people, and it is like I love getting to go down there, and I'm excited to like being able to continue to go down there more and just build on that and start to bring more to those conversations and discussions as like a newbie, and be able to bring more to the community.
Danny, I saw you unmuted. I didn't know if you
Oh
wanted.
yeah, I was just waiting. I wasn't trying to just jump in, but my coworker Jess and I went out door to door doing outreach, and a lot of everyone we talked to was fascinating. Most people were so welcoming and so friendly, even though I was a stranger knocking on their door. And the ones that weren't were very interesting characters. I love the people in Hazelwood, and I feel like they make the community what it is. And I like talking to the kids when they get off the bus every afternoon. It's a very like wholesome community.
I love that. Yeah, I would have to echo that too. I feel like Hazelwood has really welcomed us with open arms and lots of support since we, started coming into the community, even before my time here in this role with Katie and doing the needs assessment and working with the different organizations. Of course, Pastor Tim has been on our board and, has been a big supporter of ours as well. But the kids are probably my favorite. Like just every time I get to go hang out at the drop-in center and see the kids. And there was one the other day last week, I think, who was like, yeah, I used to come here a couple of years ago. And I was like, oh my God, you've grown so much. Like I didn't even recognize you. And that was it was so nice. And so just, being able to build those relationships and feel like we're a part of the community is really lovely.
You could travel the world, you'll never find another community like Hazelwood. Guaranteed.
I would say for me, it's just coming from a place where I've served communities that were kind of like bigger, where the focus wasn't really too much on like the individual needs of everybody, more like a collaborative, like, oh, we want this for, our summer programs for everyone. Whereas like now that I'm actually in Hazelwood, I'm seeing that there are very specific needs that need met. And I like to see that we're actually contributing to those being met. So it's just nice to play a specific role and not like just the overall big puzzle, which is also very helpful. But it's just nice to have those one-on-one engagements with specific people and like seeing how we can positively affect them.
Yeah, y'all are definitely a life-changing resource, not to just our programming, right? Because we definitely utilize y'all very heavily in terms of our after-school program. And we're just like, please come help us have these conversations with our kids. Like, you're so good at doing those things, and our family members, but just all of the kiddos that you're working with and the families that you're working with, just out of your drop-in center. I mean, you definitely are touching lives in a very positive way. So we appreciate you all so much. Does anyone else have any other last questions before we go ahead and end for the evening? Okay, well, thank you all again so much for joining us and for all of that information and for the work that you're doing. We just appreciate you all so much. So we do have this recorded, so we'll make sure to share it out later, and then we'll share your contact information and then also all of the awesome events that you have going on for the rest of May. And I think the June calendar came out too, so we can share that too. But yeah, thank you all so much.
Thank y'all.
Thank you, Kiyomi.
Thanks,
Thanks
everybody.
everyone for coming.
Thanks, everyone. Have a good evening.
You
You
too.
too.
Bye.